questions from the topic maternity nursing, especially from the first part, that is the reproductive system, fetal skull, true pelvis, etc. So please watch the full video. If you like this video, please like it, share it and subscribe it. And also click the bell icon so that you will get notifications if I am uploading new videos. So let us start the video. First question, the longest part of fallopian tube. Options: A. Infundibulum, B. Ampulla, C. Interstitial, D. Isthmus. Answer is B. Ampulla. So ampulla is the longest part of fallopian tube. This is a picture of a uterus, that is, this is a fallopian tube. So fallopian tube is divided into 4 parts, that is infundibulum, ampulla, isthmus, intramural or interstitial part. Infundibulum is the lateral end of the uterine tube, which is a funnel shaped structure, and it consists of a finger-like process called fimbriae. Ampulla, that is medial to the infundibulum, is the ampulla, which is a thin, dilated and tortuous structure. Isthmus, that is, it forms the medial 1/3 of the tube and it is a rounded cord-like structure. Last is the intramural or interstitial part, which lies within the wall of the uterus and it opens at the superior angle of the uterine cavity. So the infundibulum, it measures about 1.25 cm, ampulla 5 cm, isthmus 2.5 cm, intramural or interstitial part 1.25 cm. So it is clear that the longest part of the uterine tube or fallopian tube is ampulla. The narrowest part of the intramural or interstitial, the narrowest part of the fallopian tube is intramural or interstitial. Next question, the radiography of the fallopian tube after the introduction of radio-opaque contrast medium. Options: A. Pylography, B. Myelography, C. Salpingography, D. cholecystoscopy. Answer is C. Salpingography. So salpingography, it is a radiography of the fallopian tube after the introduction of radio-opaque contrast medium. Pylography, it is a form of imaging of the renal pelvis and ureters. Myelography, it is a type of radiographic examination that uses a contrast medium to detect pathology of the spinal cord. So pylography, it is related to the renal pelvis and ureters. Myelography, it is related to the spinal cord. Salpingography, it is related to the fallopian tube. Next question, inflammation of uterine tube or fallopian tube. Options: A. Uveitis, B. Parametritis, C. Salpingitis, D. Myometritis. Answer is C. Salpingitis. So inflammation of uterine tube is or fallopian tube is salpingitis. Parametritis, it is the inflammation or infection of the broad ligaments. Uveitis, it is the inflammation or infection of ovary. Myometritis, it is the inflammation or infection of myometrium. Next question, how many vertebrae fuse to form sacrum? Options: A. 2, B. 4 vertebrae, C. 5 vertebrae, D. 3 vertebrae. Answer is C. 5 vertebrae. So 5 vertebrae fuses to form sacrum. Next question, the suprapubic angle for a normal delivery. The suprapubic angle for a normal delivery. Options: A. 80, B. 100, C. 90, D. 60. Answer is C. 90. So the suprapubic angle for a normal delivery is 90. Next question, the acidic medium of vaginal canal is due to. Options: A. Moniliasis, B. Doderlin bacilli, C. Trichomoniasis, D. Gonorrhea. Answer is B. Doderlin bacilli. So the organism Doderlin bacilli is responsible for the acidic medium of the vaginal canal. The normal pH of the vaginal secretions is 3.5 to 4.5, which is acidic, and the organism responsible for this is Doderlin bacilli, which converts glycogen to lactic acid. That is, lactic acid is produced from the glycogen. Next question, the normal size of uterus. Options: A 7.5 cm into 1.5 cm into 1, B 9 into 2 into 2, C 7.5 into 2.5 into 1.5, D 7.5 into 5 into 2.5 centimeter. Answer is D 7.5 into 5 into 2.5 centimeter. So the normal size of uterus is 7.5 centimeter into 5 centimeter into 2.5 centimeter. So the normal weight of the uterus is 30 to 60 grams. And the normal position of the uterus is anteverted and anteflexed. And the normal shape of the uterus is piriform shape. Next question, the normal length of cervix. Options: A 3.5 cm, B 4.5 cm, C 2.5 cm, D none of the above. Answer is C 2.5 cm. So the normal length of cervix is 2.5 cm. Next question, endometrium will transform as dash during pregnancy. Options: A trophoblast, B decubitus, C gravid endometrium, D decidua. Answer is D decidua. So during pregnancy, endometrium is known as decidua. Next question, the uterine pacemaker situated at. Options: A body of uterus, B isthmus, C cornua of uterus, D cervix. Answer is C cornua of uterus. So uterine pacemaker is situated at cornua of uterus. What is uterine pacemaker? That is the area in the uterus that stimulate the uterine contractions, that is contraction of the myometrium during labor process. It is known as uterine pacemaker. That is one or more area in the uterus that stimulate the contraction of the myometrium during labor process is known as uterine pacemaker. And this uterine pacemaker is located near the opening of the fallopian tube. The points where the uterus and the fallopian tube meet, that is the cornua of the uterus. So cornua of uterus is a uterine pacemaker. Next question, the normal size of ovary. Options: A 4 into 3 into 2, 1 B 1 into 2 into 4, C 2 into 4 into 6, D 2 into 2 into 3. Answer is A 4 into 3 into 2 centimeter. So the normal size of ovary is 4 centimeter into 3 centimeter into 2 centimeter. Next question, location of breast is from. Options: A from 1st to 4th rib, B 2nd to 6th rib, C 2nd to 5th rib, D 3 to 6th rib. Answer is B 2nd to 6th rib. So breast is from 2nd to 6th rib. Next question, the first event of puberty in girl. Options: A menarche, B telarche, C pubarche, D pain in abdomen. Answer is B telarche. So telarche is the first event of puberty in girl. So what is telarche? Telarche is the onset of breast development. The beginning of the breast development or breast buds. It is the first sign of the beginning of the puberty that typically occurs by about the age of 13 years. So it is the first sign of puberty in a girl. What is menarche? It is the onset of first menstruation. It is a last sign of the pubertal development. What is pubarche? It is the appearance of the sexual hair. Next question. Hormone responsible for secondary sexual characteristics. Options: A. Luteinizing hormone, B. Estrogen, C. Progesterone, D. All of these. Answer is B. Estrogen. So the hormone responsible for secondary sexual characteristics is estrogen. Next question. The hormone secreted from ovary. Options: A. Follicular stimulating hormone, B. Luteinizing hormone, C. Estrogen, D. All of these. Answer is C. Estrogen. The hormone secreted from ovary is estrogen. In addition to estrogen, ovary secrete two other hormones, that is progesterone and inhibin. So the ovary excrete three hormones, that is estrogen, progesterone and inhibin. Next question. The thickness of endometrium at the end of proliferative phase. Options: A. 10 to 12 mm, B. 3 to 4 mm, C. 2 to 6 mm, D. 8 to 10 mm. Answer is B. 3 to 4 mm. The thickness of endometrium at the end of proliferative phase is 3 to 4 mm. Next question. The LH surge occurs 24 hours before ovulation, B. During ovulation, C. 24 hours after ovulation, D. 4 days after ovulation. Answer is A. 24 hours before ovulation. LH surge occurs 24 hours before ovulation. The ovulatory phase begins with an increase in the or a surge in the luteinizing hormone and follicular stimulating hormone levels. Luteinizing hormone stimulates ovulation or the egg release, which usually occurs 16 to 32 hours after the surge begins. Next question. The hormone which stimulates oocyte maturation. Options: A. Gonadotropin releasing hormone, B. Luteinizing hormone, C. FSH, that is follicular stimulating hormone, D. LHRF. Answer is C. FSH. So the hormone which stimulates oocyte maturation is follicular stimulating hormone or FSH. Next question. Fertilizable lifespan of oocyte ranges from. Options: A. 24 to 46 hours, B. 4 days, C. 2 to 4 hours, D. 12 to 24 hours. Answer is D. 12 to 24 hours. So fertilizable lifespan of oocyte is 12 to 24 hours. The fertilizable life of sperm ranges from 48 to 72 hours. So fertilizable lifespan of oocyte ranges from 12 to 24 hours and fertilizable life of sperm ranges from 48 to 72 hours. Next question. Fertilized ovum is implanted in uterus after. Options: A. 1 day, B. 10 days, C. 7 days, D. 8 days. Answer is C. 7 days. The fertilized ovum is implanted in uterus after 7 days. That is, initially the development of the fertilized ovum occur in the fallopian tube, that is from first 3 to 7 days, and later its development occurs in the uterine cavity. Next question. The corpus luteum of pregnancy is functionally active up to. Options: A. 10 to 12 weeks, B. 4 to 6 weeks, C. 2 to 4 weeks, D. 6 to 8 weeks. Answer is A. 10 to 12 weeks. The corpus luteum of pregnancy is functionally active up to 10 to 12 weeks. After that, the placenta takes its function. Next question. Bartholin's gland present in options A. Vagina, B. Cervix, C. Uterus, D. Ovaries. Answer is A. Vagina. Bartholin's gland is present in vagina. Bartholin's gland located beside the vaginal opening, which secretes a thick fluid that supplies lubrication for intercourse. So the Bartholin's gland is present in the vagina. Next question. Average blood loss in a normal menstrual cycle is options A. 50 to 100 ml, B. 150 to 200 ml, C. 100 to 150 ml, D. 200 to 250 ml. Answer is A. 50 to 100 ml. So average blood loss in a normal menstrual cycle is 50 to 100 ml. That is, a blood loss of 10 ml to 80 ml is considered as normal. Next question. The constant phase in menstrual cycle. Options A. Menstrual phase, B. Proliferative phase, C. Luteal phase, D. Ovulation phase. Answer is C. Luteal phase. The constant phase in menstrual cycle is luteal phase. That is, a period between ovulation to the beginning of next menstruation is called luteal phase or secretory phase or post-ovulatory phase. The length of the phase, this phase is fixed, that is 14 days. So the most constant part of the female reproductive cycle is the luteal phase. Next question. Male internal genitalia develops from options A. Mullerian duct, B. Wolffian duct, C. Primordial duct, D. Basal duct. Answer is B. Wolffian duct. So male internal genitalia develops from Wolffian duct. Mullerian duct is one of the bilateral ducts in the embryo that form the uterus. This is vagina and fallopian tubes. Wolffian duct is a duct in the embryo which develops ductus epididymis, ductus deferens, seminal vesicle, ejaculatory duct, ureter and pelvis of the kidney. So male genital organs develops from the Wolffian duct and female genital organs develop from the Mullerian duct. Next question. The hormone responsible for the tingling and sense of fullness in the breast. Options A. Aldosterone, B. Progesterone, C. Estrogen, D. HCG. Answer is B. Progesterone. So the hormone responsible for the tingling and sense of fullness in the breast is progesterone. Next, the nervous system develops from options A. Mesoderm, B. Ectoderm, C. Endoderm, D. Inner cell mass. Answer is B. Ectoderm. So the nervous system develops from ectoderm. At third week, the embryonic tissue divides into three primary germ layers, that is endoderm, mesoderm and ectoderm. Structures produced by three primary germ layers are as follows. From the endoderm, these are the structures that are formed from this endoderm, that is epithelial lining, gametes, that is both sperm and oocytes, etc. And from the mesoderm, the structures produced by this germ layer is gonads, muscles, cardiovascular system, genital ducts, kidney, ureter, dermis of the skin, cartilages, bone and other connective tissue, notochord, cardiac muscles, blood vessels, blood and bone marrow. The structures produced from the ectoderm is all nervous tissue, epidermis of skin, mammary gland, neuroepithelium of sensory organ and components of head. So nervous system is developed from ectoderm. Next question. Placenta is developed by options A. 3rd month, B. 4th month, C. 20th week, D. 2nd month. Answer is A. 3rd month. That is, placenta completes its development by 3rd month or 12 weeks. Next question. Maternal part of placenta is formed by options A. Decidua basalis, B. Cytotrophoblast, C. Chorion frontosome, D. Syncytial trophoblast. Answer is A. Decidua basalis. So Decidua basalis is the maternal part of placenta and the fetal part of the placenta is the chorion frontosome. Next question. Weight of placenta is to weight of baby. Options A. 1:6, B. 6:1, C. 1:4, D. 1:5. Answer is A. 1:6. Next question. Diameter of the placenta is options A. 20 to 30 cm, B. 25 to 35 cm, C. 15 to 20 cm, D. 20 to 25 cm. Answer is C. 15 to 20 cm. That is, diameter of the placenta is 15 to 20 cm. That is, at the beginning, the shape of the placenta is discoid shape, and at term, the placenta becomes circular disc. And placental development begins by 6th week and completes by 12th week. And its diameter is 15 to 20 cm and having 2.5 cm thickness and 500 gram weight, and is developed from chorionic villi. Next question. Oxygenated blood enters the fetal circulation from umbilical vein through options A. Ductus venosus, B. Ductus arteriosus, C. Intrahepatic vein, D. Intrahepatic artery. Answer is A. Ductus venosus. So the oxygenated blood enters into the fetal circulation from umbilical vein through ductus venosus. That is it. This ductus venosus empties oxygenated blood into the inferior vena cava from umbilical vein. Next question. The vessel containing highest oxygen concentration in fetal circulation. Options A. Umbilical vein, B. Pulmonary artery, C. Ductus venosus, D. Ductus arteriosus. Answer is C. Ductus venosus. So the vessel containing highest oxygen concentration in fetal circulation is ductus venosus. Next question. Obliterated umbilical vein is called options A. Ductus ovale, B. Ligamentum arteriosum, C. Ligamentum teres, D. urachus. Answer is C. Ligamentum teres. So the obliterated umbilical vein is called ligamentum teres. Next question. Fetal blood flow through the placenta per minute. Options A. 200 ml per minute, B. 800 ml per minute, C. 600 ml per minute, D. 400 ml per minute. Answer is D. 400 ml per minute. So the fetal blood flow through the placenta per minute is 400 ml per minute. That is, the fetal-placental blood flow is about 400 ml per minute. Next, the uteroplacental blood flow through the placenta at term, that is, uterine blood flow at term is 500 to 600 ml per minute. So uteroplacental blood flow is 500 to 600 ml per minute and fetoplacental blood flow is 400 ml per minute. Next question. Umbilical cord soffule is synchronous with options A. Maternal pulse, B. Fetal pulse. C. None of this. D. All of the above. Answer is B. Fetal pulse. So the umbilical cord cephule is synchronous with fetal pulse. Umbilical cord cephule or fetal cephule is a sound produced by the rushing of blood through the umbilical arteries, which is synchronous with the fetal heart sound. Uterine cephule, which is a sound produced by the rushing of the blood through dilated uterine vessels, which is synchronous with maternal pulse. So umbilical cord cephule or fetal cephule is synchronous with fetal pulse and uterine cephule is synchronous with maternal pulse. Next question. HCG is secreted by options A. Syncytial trophoblast, B. Thyroid gland, C. Ovary, D. Uterus. Answer is A. Syncytial trophoblast. So HCG is secreted by syncytial trophoblast. In addition to this, HCG syncytial trophoblast secretes human placental lactogen and estrogen. Next question. Fetal circulation functions fully by options A. 12th week, B. 28th week, C. 8th week, D. 6th week. Answer is A. 12th week. Fetal circulation functions fully by 12th week. Next question. Placental blood circulation is through options A. Villi, B. spiral arteries, C. chorionic membrane, D. umbilical artery. Answer is B. spiral arteries. That is about 120 to 200 spiral arteries carry oxygenated blood and open into intervillous space of placenta. Next question. Total length of human gestation. Options A. 230 days, B. 240 days, C. 280 days, D. 250 days. Answer is C. 280 days. So total length of human gestation is 280 days. Next question. Pre-embryonic stage is up to options A. 7 days, B. 14 days, C. 28 days, D. 12 days. Answer is B. 14 days. So pre-embryonic period, that is the first 2 weeks after conception. Embryonic period from the 3rd week to 8th week. Fetal period is from the 9 weeks to birth. Once again, pre-embryonic period is the period that is the first 2 weeks after conception. Embryonic period is the 3rd week to 8th week. Fetal period is from the 9th week to birth. Next question. Total number of sutures present in fetal skull. Options A. 4, B. 3, C. 5, D. 6. Answer is A. 4. So the total number of sutures present in fetal skull is 4 sutures. So the sutures include the sagittal suture, lambdoid suture, coronal suture and frontal suture. Sagittal suture lies between the parietal bones. In the picture, this is the frontal bone, this is the parietal bone, this is the occipital bone, and this is the posterior fontanelle, and this is the anterior fontanelle. So the sagittal suture, it separates the 2 parietal bone. So this will be the, here comes the sagittal suture that separates the parietal bone. Next suture is the lambdoid suture, that is extends from the posterior fontanelle, separate occipital bone from parietal bones. So lambdoid suture, it extends from this posterior fontanelle, which separates the parietal bone and the occipital bone. Next suture is the coronal suture, that is extends from the anterior fontanelle, separate parietal and frontal bones. So coronal suture, it extends from this anterior fontanelle, which separates the frontal bone and the parietal bones. Next suture is a frontal suture that lies between the frontal bones. This frontal bone, it separates the frontal bone. So sagittal suture is the suture that separates the parietal bone, and lambdoid suture is the suture that extends from the posterior fontanelle, which separates the occipital bone and the parietal bone, and coronal suture it extends from the anterior fontanelle, which separates the frontal bone and the parietal bone, and frontal suture it separates the frontal bones. So there are 4 sutures in a human fetal skull. Next question, posterior fontanelle is otherwise known as. Options A, brecma, B, lambda, C, vertex, D, occiput. Answer is B, lambda. So posterior fontanelle is otherwise known as lambda and anterior fontanelle is otherwise known as brecma. Next question, suboccipitobrecmatic diameter is. Options A, 9.5 cm, B, 10 cm, C, 11.5 cm, D, 14 cm. Answer is A, 9.5 cm. The suboccipitobrecmatic diameter is from below the occipital protuberance to the center of the anterior fontanelle. It is the engagement diameter in occipito-anterior with complete flexion. So it is from below the occipital protuberance to the center of the anterior fontanelle, and it measures about 9.5 cm. Next question, engaging diameter of vertex presentation. Options A, suboccipitofrontal, B, suboccipitobrecmatic, C, submentobrecmatic, D, mentovertical. Answer is B, suboccipitobrecmatic, which is the engaging diameter of the vertex presentation. Next question, normal female pelvis. Options A, android, B, platypaloid, C, gynecoid, D, anthropoid. Answer is C, gynecoid. So gynecoid is the normal female pelvis or the true pelvis. Android pelvis, it is a heart shaped. Anthropoid pelvis is the oval shaped. Platypaloid pelvis is the kidney shaped. Once again, android pelvis is the heart shaped. Platypaloid pelvis is the kidney shaped. Anthropoid pelvis is the oval shaped, and gynecoid is the ideal shape with a round to slightly oval, which is a normal female pelvis or true pelvis. Next question, the type of pelvis that can occur in women with rickets. Options A, contracted pelvis, B, platypaloid pelvis, C, anthropoid pelvis, D, gynecoid pelvis. Answer is A, contracted pelvis. That is a type of pelvis that can occur in women with rickets is contracted pelvis. It means a pelvis in which one or more of the principal diameters are reduced to a degree that causes difficult labor. Next question, the only diameter which can be measured by intravaginal finger examination. Options A, diagonal conjugate, B, obstetrical conjugate, C, transverse diameter of brim, D, transverse diameter of pelvic outlet. Answer is A, diagonal conjugate. So the only diameter which can be measured by intravaginal finger examination is diagonal conjugate, which is about 12 cm, and it means a distance between the lower border of symphysis pubis to midpoint of sacral promontory of sacrum. It is a distance between the lower border of symphysis pubis to midpoint of sacral promontory of sacrum, which is 12 cm, and it is the only diameter which can be measured by intravaginal finger examination. Next question, the pelvis in which ala of both sides are absent. Options A, Robert pelvis, B, platypaloid pelvis, C, Nagel's pelvis, D, rachitic pelvis. Answer is A. Robot pelvis. So robot pelvis is a pelvis in which ala of both sides are absent. We know that platypelor pelvis is a kidney-shaped pelvis, and Nagel's pelvis is in which there is only one ala is absent. Rachitic pelvis is a contracted and deformed pelvis, most commonly a flat pelvis occurring from rachitic softening of the bones in early life. That is after any rickets disease. Next question. The shortest diameter of pelvic outlet. Options A. Oblique diameter, B. Bispinous diameter, C. Intertuberous diameter, D. Anteroposterior diameter. Answer is B. Bispinous diameter. So the shortest diameter of the pelvic outlet is the bispinous diameter or the transverse diameter, which is about 10.5 centimeter. It is a distance between the tips of two ischial spine, that is the bispinous diameter. Next question. In face presentation, denominator is options A. Vertex, B. Frontal eminence, C. Acromion, D. Mentor. Answer is D. Mentor. So in face presentation, denominator is mentor. What is denominator? It is a bony landmark on the presenting part used to denote the position. Bony landmark on the presenting part used to denote the position. So in vertex presentation, the bony landmark or the denominator is the occiput. In broad presentation, it is frontal eminence. In bridge presentation, it is sacrum. In shoulder presentation, it is acromion. And in face presentation, it is mentor. So friends, these are the questions related to the topic maternity nursing, especially from the first part, that is the reproductive system, true pelvis and fetal skull, etc. So if you like this video, please like it, share it and subscribe it. And also click the bell icon so that you will get notifications if I am uploading new videos. So thank you for watching my channel.